Hello. Are you able to hear me?
Yeah. Hello.
Good evening. I just got a message on my computer that said something about my speaker. I had never received that message before, so I was just making sure you could hear me. We still have about minutes before we officially start, so
Okay.
I was going to make sure.
Hello, everyone.
Hi, how are you?
Doing good. How are you, Professor?
Doing well, doing well.
Hello.
Hello. So we still have about 3 minutes now before we get started, so just to let you know, you all can go ahead and start placing your name and your campus in the chat. So that will be out of our way once we officially get started. So how is everybody's week going? It's going fast for me. How's your week going? Everything okay?
Definitely going fast.
It really is. And I know it's the same 24 hours, but it just seems like it's moving really, really fast. So we still have a minute and 30, 40, maybe 40 seconds before we officially start. Okay, we still have about 50 seconds before we officially start. If you would, good evening, good afternoon to everyone. Go ahead and place your name and your campus in the chat. Go ahead and place your name and your campus in the chat. We have probably about 30 more seconds. Good evening to everyone. Go ahead and place your name and your campus in the chat. Also, ensure that your first and your last name, as it is listed in Fortis, is on your screen as well. So we have about 20 seconds before we officially start. Okay, so we will go ahead and start. I believe this is the class that we're going to have some visitors in. Not really sure, but anyways, we will move forward. So good evening to everyone. Hopefully everyone is doing well. The week is moving pretty fast. It's already Wednesday, almost Thursday. So if you would go ahead and place your name and your campus in the chat. Just go ahead and get that out of the way because we don't want anything to come up and we have to review the record and We had a picture and we didn't have your name and your campus. So we'll give you a minute or so to do that. Go ahead and place your name and your campus in the chat. Also, ensure that your name as it is listed on Fortis's roll is also on your screen. So you just find your 3 buttons. On my screen, it's just three little dots. And you click it and you click rename. So make sure that all those things matches. Because as a reminder, these sessions are reviewed by the attendance coordinator. They check the Zoom log in, log out. Even when we go to the breakout rooms, all that stuff is recorded. So just so that you can make an informed decision. Also, just as a reminder, ensure that your cameras remain on at all times. Even if you have to walk away for whatever reason, send a message to myself. You do not have to send a message to everyone. Place a message in the chat, but leave your cameras on. A few of you all are just coming in. Go ahead and place your name and your campus in the chat. So let's go ahead and look at, let's just look and see where we're at. We know where we're going, which is Unit 1 exam is next week, which is week 3. So that's where we're headed. So let me just look at the course here. Let me pull it up and let's just see. Where are we at on our list here? So you all know after you take that first exam, when I tell you things, to me, it just really, really starts moving really fast after that first exam. So we do know we have 3 or 4 exam reviews. So it is not mandatory, but it is strongly encouraged to attend as many live reviews as you can. We have looked at you all's schedule and have planned a variety of different times and dates. So hopefully you can attend one of the live sessions. And when you do, make sure you put your name and your campus in the chat as well, because those sessions are reviewed also by the attendance registers. In addition to that, in the past, what we have done, we have provided the link so that you can go back and view the live sessions on your own at your leisure. And those are, even though you attend live sessions, still go back, because that hearing things multiple times and in different ways. There are 5 of us, I believe. And so that just ensures that you really, really have a good understanding of the concepts. And if you don't, it ensures that you know which concepts to ask about prior to the exam. So either way, you would be good. Once you go back and review those live recordings, I recommend just doing it like in little tidbits, a few minutes at a time, so you don't get overwhelmed, just to make sure that you are making the connections and really understanding the concepts. So that is where we're going. Unit exam 1 is next week. So for this week, we were supposed to complete discussion question number 1. We had Saunders NCLEX questions. Were you all able to get those completed? Any problems with that? And then you had CJ Sim, outpatient and community, Mackenzie Bramble. Any problems with your CJ Sim or your NCLEX?
I do have a problem with the CJ Sim. It says I'm not authorized to use it, so I can't get on it.
Did you submit a help ticket?
I didn't submit the help ticket.
Yes, do that, because we couldn't get in. I couldn't get in initially either, but I submitted the little help ticket and they were pretty good about getting me on in. And it's probably just the click of someone's button to get you in. So yes.
Professor,
Mm-hmm.
do you mind if I ask her something real quick? Because a lot of our classmates had the same problem. So they sent out an email and it has your username and your password in that email. So once you log in initially, you have to change your password. I think that email was sent out maybe like 2 days before we started, like a few days before we started, like July 5th or something like that. So try going to your email and they will provide you with your login information.
Now,
Okay.
it was from Nurse Think. Is that still
Yep.
correct? Yes. So
Yep,
look
yes,
for
ma'am.
Nurse Think, and you might not have known to look for Nurse Think. So because we're saying CJ Sim and we're not saying Nurse Think, so you probably did receive it and just didn't realize that was something that you needed. Okay. Any other questions that we might have a solution for?
Yeah. So I know that we're doing a blended class. I don't know if you're just subbing in or if it's a blended class. But I don't think our professor actually sent us links for exam reviews because I'm looking on Canvas now and I don't see anything that says anything about these reviews
Okay.
or where to find the links for them.
Okay. We'll make sure we have that announcement.
We have exam review. I don't know if you have Alanis, but our exam review is in our announcements.
Mm-hmm. Yeah, and if not, we'll get that to you. So,
Okay. Do you know what that announcement's called?
Live review. I think it says live review.
It's it don't have a title to it. She just sent it out today, I think.
Yeah, it's there. And if not, we'll post it for you. So exam review schedules, we need to ensure that we might need to go back and repost that and give a title to it. Nurse Think to find your CJ Sim. Anything else?
I have a question about the Saunders. I don't know if it's just my professor, but the subcategories that she gave, I don't see it on the Saunders.
Okay, yeah, still submit a help desk ticket because I think the category. Anybody else having problems with the categories?
Yes, because we got a new edition, so we changed.
It did. We're on the 10th edition, and I think initially your NCLEX is pulling you to the 9th. And so I think you need a help desk ticket to push you on over to the 10th. Yeah, that's what, yeah, I do remember that.
Okay, I have the new one, so.
So look in the chat. They sent you a message in the chat. Selecting categories. Caitlin, just go ahead and tell us that out loud. Caitlin, where you at?
Yeah, so I was having that same problem. When you're selecting it, you need to go to the exam and not just the study questions, and then it will pull up all your categories. And then you can also choose how many questions, because you can't really suspend a session unless you're in the exam.
I went to the exam part of Saunders, and then it was foundation of care, and I clicked down so it could show all the other options, not just foundations. And like, for example, I sent her a message. It doesn't have special population. It's not showing community health.
You might need a help desk ticket then.
Okay.
No, because in the new edition, it's called something else. It's called the I forgot. Let me take a look because I did it already.
Oh,
so
thank you.
We're talking through that in the course. I'm getting ready to post a little case study thing that we're going to work on. Any other questions? We're looking at, she's pulling that up real quick for you. Any other questions that we need to talk to find a solution? NCLEX, CJ Sims, live review sessions. That's it? Okay. All right. So go ahead and pull that up and share that with us. And I'm going to post this real quick.
If it's easier, I have a picture. I could show you the picture through the camera.
Are you able to put something in the chat? I don't know if you can or not. You might can't put that in the chat, can you? Let's see here. So we've troubleshooted everything. Is that what you all are saying? That's it. Okay, well, good. So just waiting on my computer here.
So it's called population health nursing. That replaces the
Okay, thank you.
I was trying to see if I could copy and paste the link to the exam schedule, the review, but I don't think I could do that. But I'm sure it's in your professor's announcements. Like you said, it didn't have a title. In mine, it says term schedule for exam and HESI reviews. Please plan accordingly. So that's the if I can share the doc before this is over in Zoom, I will. But that's how it's titled in mine. All right, and I'm going to share this document, and we're going to use this document tonight to talk through the concepts for exam, the prep for the exam, to ensure that we've narrowed down our focus and we really do have an understanding of those concepts. And then if we have time, we'll do the Kahoots that we have also. So I'm going to share the document in the announcements, and we're going to put you in breakout rooms, and then we're going to bring you back as a whole group, and then we will review it. So accept the invitation to the breakout room. And the name of the topic, the document will say 206 week 2. And this is nothing official. It's just something that I kind of just put together here. Let's see, we have 32 people here. So accept the invitation to the breakout room. And then for those of you, sure, one of my students will be in the course, so you will be able to look at the document. Accept the invitation to the breakout room and open the document. Let's discuss it, and then we're going to come back as a whole group.
Dr. Morton, I got kicked out of my group. I don't remember which one I was in.
Okay, we'll put you in one. I was uploading that document here. Just give it a second. Okay. Let's see. Kimberly, looks like you were in. Just saw your name. It just went away. But we'll just put you in a group, like I said, because there's nothing official. We're just.
I can't hear you. I'm sorry.
No, I said the invitation should be coming here in just a second.
Okay.
Ms. Webster, accept the invitation to go to the breakout room.
Okay. Sorry, I had to switch from my phone to my laptop.
Oh, honey, it's no problem. It happens to all of us. Usually I'm logged in on my phone and my computer just in case something happens.
I just woke up from night shift, so I was like, okay.
Yeah, so the invitation should be coming through now. Hello. Hello.
Hello, I'm from Professor Aloni's class. I had a hard time. I hadn't noticed this, that we were switching the professors today.
Okay. Well, welcome. So right now we are in groups working through a case study. And
Okay.
so I'm going to send an invitation so you can go to the breakout room. Surely someone in the group will have a case study pulled up. What you
Okay.
all do is talk through it in small groups, and we'll come back and talk through it in a whole group and just ensure that we have the concepts. And then if we have time, we'll move on to the Kahoots. So let me find a room that's not overcrowded. Let's see, I'm going to put you here and just accept the invitation. It should be coming through now.
Okay, thank you.
You're welcome.
Um,
So y'all can video.
Oh, she's in here.
Hey.
It's really strange. We don't have the-
email it to y'all.
for the
Yeah, so just share your screen because that kind of gets to time wise, just share your screen if you can, and you all just having a conversation about it.
Okay.
Mm-hmm. Just share your screen. Yeah, and that way you all can move through it.
So Corey, you have it?
Yeah, I have it, but I'm using my tablet for my Zoom, and I'm on my actual computer. So,
My internet kicked me out. That's why I left for like a minute.
Sure. Let me put you back in the room and see if it has you where. So you're just gonna go to the room because it's nothing official.
So I went to room 5, and then my internet kicked me out. But I also wanted to ask you, in room 5, there's only 2 other girls, and none of them are originally in your class, so we haven't received anything. But my internet kicked me out, so I wasn't sure if you mentioned that already on what we should do.
Okay, I was hoping that someone in my class would be in out of the 40 of you. I was hoping at least one.
I know.
What's the odds of that happening?
I know, right?
That happening. So let me see if Miss Crawford. Miss Crawford, hello, are you there? Miss Crawford, you're on mute.
The announcement for the PDF, so.
Miss Crawford, whose group were you in? You were in 10, right?
Yeah.
Okay, so Misa, can I put you back in there? All right, Caitlin,
All right,
I'm
thank you.
all in group 10.
Okay, thank you.
Gonna move you to 10. Okay. And you were in 5, right, Caitlin?
Yes.
Okay, I'll go get the others and put them in 10.
Okay, thank you.
Hi, you're welcome.
What the need is. Do they need a wheelchair? Do they need a gurney assist?
What happened, Caitlin? Did you not get the invitation?
No, it says that I'm assigned to join breakout room 5.
No, I sent you to room 10. Let's see. Let's see if I can find you again. Okay, so I'm just gonna see you to room 1. Let's try 1. See if did it pop up? Did 1 pop up?
Yes.
Okay.
Yes. Okay, thank you.
You're welcome. So how are we making it through the case study? We understanding the concepts, or we struggling with the concepts?
So we were in a group, and nobody was from your class.
Okay, did you communicate that to me?
I'm sorry.
You all didn't communicate that to me.
No, I didn't know if we left it, if we'd be able to get back in, or
you can send
how it worked.
Yeah, so in breakout rooms, you can send a message like it was. I'm not sure, but you can ask. I think it says broadcast something. Yeah.
Something happened to our group, and we tried sending a message, so I don't know if you got it.
I only got one message, and the message I did get, I went to that group. So go ahead.
It looks like if we tried to send a message, it would just send to like our group, like our breakout group.
Oh, I think you probably had to pick me. Yeah, you had to select me. Yeah, it would come to me. It did, because I got a message. And
okay, sorry about that.
No, not a problem. Just didn't want you sitting there wasting wasting time, not
Yes.
being effective. So let's go ahead and just talk through it. So you some of the groups you all were having some great conversation. I did hear you all that were the groups that I did visit. Let me pick it up here. So we have state, and I'm gonna stop and just let you all interject, and I'll just correct you if there needs to be some correction. Otherwise, you all feel free to jump in and share what you know, agree, disagree, and if you disagree, tell me why you disagree. But it's student led. So we have Stacy and Kim. They are preparing to visit the congressman to discuss the community health. Before going, they have decided to review a few things. You got Stacy and Kim. Kim states, when assessing the health of a community, the nurse would examine indicators of community knowledge and practices of preventative health behaviors like safe playgrounds, lighted streets, designated driver programs. So we're thinking about the community as a whole. So the next thing it says, discuss community-based nursing examples. So tell me, what are some examples of community-based nursing?
Like a school nurse?
Keep going, you all.
A school nurse,
Planned Parenthood, the little pop-ups.
Community-based programs that help with funding vaccinations.
So Kim says yes. Oh, go ahead. Go ahead. Was someone getting ready to speak?
Yeah, I was gonna say, when you meant pop-ups, did you mean like when they have like street fairs and where they have like healthcare stations and stuff like that? You find community-based nursing there too.
Yes. Kim states yes, that is correct. Doctors, nurses, social workers, therapists working together to manage care for a complicated client that receives home care is an example of community-based nursing. Lucy states, so you mean to tell me that working at a local food pantry to distribute food each week is not an example? Do you agree or disagree?
I believe that it is, because you're helping with their nutrition aspect.
I think just handing out food isn't nursing, but if you was to teach them about nutrition, it would be community-based.
Exactly. We agree. Yes, we agree with the latter. So just working at that food pantry to distribute food each week is not, but if you're adding that education piece to it, yes. Great. Lucy asks, how does public health impact primary, secondary, and tertiary healthcare services? What is public health for those different types of services we provide?
I feel like public health provides knowledge to prevent an issue, a primary incident where you even have to go see a doctor to begin with.
Yes, keep going. Someone else.
You'd provide education on some kinds of sicknesses around the community and how to keep yourself healthy, like hand washing and things like that.
Great. Someone else.
Yeah, I mean, if you're preventing the person from ending up in the hospital, you're reducing the burden on more like critical settings or acute settings like ERs, like from people showing up with disease. Like if you do, for example, reduce the incidence of cancers like prostate cancer, screen early on, like that's a way of preventing a strain on that service.
Great. Who else is speaking? Who else? One more. Go ahead.
I was gonna say like screening as well,
Mhm.
and like finding out if they have those diseases on time, and after finding out that they do, how to maintain it so it doesn't get worse somewhat.
Okay. So all of those things that you all have said are correct. So if we were to list one word that would describe how public health impacts all of those different levels of healthcare, begins with an F. What word would we say? Public health is that blank for primary, secondary, and tertiary. It is a what? F?
First stop. Oh, FO, sorry.
F-O. I'm Vanna, I'm turning the letters. U. Public health is that what?
Foundation.
Foundation. Yes. All of those are great examples, but it's that foundation. Yes. Great. So remember that. Ding, ding, ding. That keyword is that it serves as that foundation. Yes. So what are benefits of Medicare and Medicaid programs?
They're usually at no or very low cost to the person seeking the services.
They sometimes offer transport services to and from doctor's appointments.
It's for lower income like families and for the elderly. So for more like vulnerable populations.
Can also help with medications and the cost of medications.
Great. Being free. Okay. So those programs are government, that's government money, and it allows for access to healthcare services for the elderly, for those who are underprivileged. All those are great examples. So just know Medicare and Medicaid, those are programs that's funded by the government. It's government money that allows for access to healthcare services, whether it be prescriptions, whether they pay a no cost or a low cost, so that they can get transportation, so they can they have vouchers, so that they, I know in our area, we call it the WAPIT bus. It takes people where they need to go. And it's like 7 days a week, even if it's going to a church group service or something, they're able to go there. So it's government money that provides access to healthcare services of different sorts, particularly to the elderly and to those that are underprivileged. Medicare and Medicaid. So Medicaid traditionally takes care of which age group of people?
Younger.
The younger. And I always remember Medicare because it takes care of which age group?
Elderly.
We care about everyone, but we really care Medicare for the elderly. So those 65 and older. Okay, great. Okay, let me get back to my little document here. Any questions so far? All right, so name 3 federal health agencies. Name 3.
DA, FDA, NIH, CDC.
World Health Organization.
OSHA. NIOSH.
Okay. Anyone else? 3 federal health agencies. So is quality and safety in nursing education, is that a federal health agency?
There's a Health Resource and Services Administration.
Okay.
Is that what you're talking about?
No, quality QSEN. Y'all know, you all used to hear us saying QSEN, QSEN. You remember that abbreviation? But quality and safety in nursing education is not a federal health agency. So just make sure that you understand that it is not. But yes, Centers for Disease Control and Prevention, they are a federal health agency. National Institutes of Health, That's remember I told you all that's who I actually work for in coming down the what they got the totem pole. At the top of the totem pole is National Institutes of Health. So agencies for healthcare research and quality. Those three are the federal health agencies that we usually talk about in community. Centers for Disease Control and Prevention, National Institutes of Health, Agency for Healthcare Research and Quality, but not QSIN, or Quality and Safety in Nursing Education. That one is not a federal health agency. Okay, Kim states, everyone knows that date in March when the World Health Organization declared the virus COVID-19 a pandemic. It was, what was that date, you all?
Was it March 12th?
Not March 12th, pretty close.
13th.
Hey,
13th.
What was it?
March 13th.
It was,
it was March something.
I said March 19th, I thought.
2020.
March 11th. I don't know.
Someone else?
March 19th?
February?
No, it was in March. It was March. We're correct about it being in March.
I think it's March 11th.
March 9th.
Did we say March 11th? Did I hear March 11th?
Yeah.
Okay.
I said that.
Okay, great. March 11th.
The kids got out for spring break and never went back. That's all I remember.
What I was gonna say. Do you
It was
remember
a month
where
before
you
my
were
birthday.
on March
That's all I
11th?
remember.
Do you remember? So share your story just a second. Where were you at March 11th when that popped up on the screen or came to your phone or you got that phone call? Where were you at?
I was a school teacher and we got out for spring break that week. Like that week was spring break and we never came back. That's what I remember.
I was in after school. I taught high school. I was actually working. We were collaborating with the middle school. We were doing an after school program, after school science. And we were actually talking about your brain and drugs. So the students were creating this thing about, we were designing our brain and then the brain that was on drugs and the brain that was not on drugs. And so actually the teacher that I was collaborating with, the middle school teacher, her daughter called and said, "Mom, come get me. I need you all to bring the big truck." And she was like, "What? Bring the big truck? What's going on?" And by that time, the our phones and the screen that we had up, stuff just started popping up. Yes. So the World Health Organization declared the virus COVID-19 a pandemic on March 11, 2020. That's when they declared it. Now, you know, we're saying that it was out there before then because we people had some experiences with some things around probably December or November the previous year in 2019. Anyone had anybody get sick and they just told them that
I definitely did.
In my house. In
Exactly.
my household, everybody in my house got sick. We lost our nose, our senses, all of that. And this was in like November, December on my birthday time of 19. We all got super sick. We had to call off of work. Everybody was out of work for almost a month at my house.
Yes. Go ahead. I'm sorry. Go ahead. Go ahead.
Definitely did. I was sick. I was so sick in December and I almost lost my job because they was saying that I couldn't be off for 5 days in a row, but I couldn't even see straight and I was it was coming out of both ends and I was just like, I don't know what's going on. I'm so sick. That was in December though.
Exactly. So everybody's thinking back now, okay, you know, did it start as early as the end of October? But for sure, we're thinking November. For sure, because everyone has some type of experience. If it was not them personally, it was someone close to them that was the sickest that they had ever been, is what they say. And they really didn't have a reason or a diagnosis for them. And you are leading me into the next question that I'm going to ask. What were those common signs and symptoms that people were complaining of?
Loss of taste, loss of smell, loss of breath in general, just not doing anything. Headaches,
breath, fever, fatigue, headache. Yes. Yes.
The coughing, that cough, that dry cough was what got you. It was the cough with no production.
Exactly. So March 11th, you all good. It's like that day everybody said, "What were you doing? I remember when." And so yes. So here we go. Kim and Stacy, they're still talking because remember, they're trying to go see Congressman Blake. Kim and Stacy are thinking about approaching their congressman for creation of policies that are more impactful for community health. And I'm going to share my screen here just because I know some of you, I don't have the document. Kim says the healthcare system is divided into two components. Primary care, which is private healthcare. I'm going to try to share here. Well, one of you all share your screen because I'm trying to pull up two things at one time. Share the document real quick here. Who's able to share their screen to help us out? Miss Taylor, Delora, are you able to share your screen? So it's the little green button at the bottom. Okay, that has the arrow pointing up. But on my screen, at least it shows us that. Okay, so she's going to share screen, and we're kind of halfway through the case study. So while she's doing that, what are those three agencies that are federal health agencies, you all?
Yeah, the NIH, CDC.
One more.
AHRQ.
Yes.
The Agency for Health Research. Okay.
And what was that date for COVID?
March 11th.
Okay. Miss Taylor, do you have it? And what was that word we used for public health?
I'm sorry, document?
Professor, are we supposed to be filling this out to turn it in at the end of the class? Or we're just discussing amongst us?
We're just discussing this. We're ensuring that you understand all of your reading assignments from week 1, 2, and so that you're prepped for the unit exam. Believe it or not, you all are, so far, you passing that exam if you are understanding these concepts. It's just a different way. This is nothing official, so don't go and say, oh, she has this document that we didn't get. It's just something I create. I just add people to it, Kim and Stacy or whomever pops up in my head. And I just think you all are more, you do understand the concepts, but to me, it helps you all to kind of think through it better this way. So this is nothing official. This is just something I just created. Okay, so I'm gonna go ahead and
are not in your class. Are we gonna get this recording?
the recording. I don't know about the recording. I don't know. We'll have to see about that. Okay, so Ms. Taylor, you were unable to share. Ms. Barnum.
I was gonna say because Jacinta has shared her screen with us.
Okay, I was thinking it was you, so it's Jacinta.
Oh, no, it's Jacinta, yes.
Okay, I had it wrong. Okay, because you all were having some healthy conversation when I came to your group. Jacinta, where you at? Go ahead and share. Are you here? Okay. So we are, okay, we're right there. Okay, go ahead. So I need someone else to volunteer and kind of talk us through it. I'm going to jump in. I need to hear, you all need to hear a different voice besides mine leading this. So someone else kind of lead us through this. And you know where to stop and start at, because I kind of say discuss something or I ask a question. Okay, I'm going to be quiet, I promise. Most of the time. Go ahead.
Kim and Stacy are thinking about approaching their congressman for creation of policies that are more impactful for community health. Kim says the healthcare system is divided into two components, primary care and public health. Stacy says we need to do some more homework before approaching Congressman Blake. Kim states, well, let me tell you about healthcare in the United States. Stacy corrects Kim when she states which of the following.
So it says Stacy corrects Kim when she states which of the following. So you're looking at each statement as though, and some people like true or false, correct or incorrect. So if what you're reading is incorrect, Stacy needs to correct her. And I need you to tell me what word needs to be changed to make it correct. Do I need to say that again? Or do we understand what we're doing?
Got it.
Got it. Let's go.
Healthcare costs are kept low and the indicators of health are among the best worldwide. She needs to be corrected. That's incorrect. We are one of the we have the highest cost of healthcare, and we are among the best, but we have the highest cost. So she needs to be corrected.
Do we agree?
I agree.
Yes, agree.
Okay, let's keep rolling. Good.
Healthcare costs are low, which has resulted in poor health outcomes, which I do believe that is false. She does need to be corrected. The costs are not low, which we just confirmed.
They are extremely high. Exactly. We agree. As even with insurance sometimes.
Yeah.
Good. Keep going.
So the next question or with that one?
Oh, the next question, unless someone else wanted to chime in.
Yeah. Healthcare costs are the highest in the world, but the indicators of heal that are not the best in the world. Did I read that right?
Health. I guess I left.
Oh, okay. I'm sorry. But the indicators of health are not the best in the world. I think we have one of the best, but yeah, definitely it's high. So I don't think she needs to be corrected because we do have one of the best.
What do we think, you all?
I agree.
I agree.
Yeah, I agree. Depends what you consider best, though. There's like a caveat there.
Mm-hmm.
Like, you'll get saved if you go to the hospital, but in some other regards, like, it's not the best all around. Like, some people don't do as good as others in hospitals, you know?
So
we have a lot of malpractice.
We are not the best
look back at that question. Look at that statement, you all.
It said the indicators of health are not the best in the world.
Got it.
That is true.
Our indicators of health because we're like one of the fattest areas in the whole world by what we eat, and our health choices are very poor in what we do. So the indicators of health is not the best in the world.
So
we would agree with that statement?
Correct. That would be correct. So healthcare costs are the highest in the world, but the indicators of health are not the best worldwide. So she does not need correction because that is correct.
I read the question wrong. Sorry.
Exactly. So no problem. When we make mistakes, we also learn. So when you are test taking tip, when you're reading through that question and you have that answer choice, make sure that both sides of the answer choices, like this right here gave you healthcare costs are the highest in the world, comma. Then it starts talking about something else on the second part. Make sure that you're understanding the answer choice. Is the answer choice talking about the same thing throughout the answer choice? In this case, it's not. And so therefore you will get mixed up when you're selecting the answer choice. So if I were to ask you the question, okay, go ahead and read the next statement and then I'll ask you the question. Go ahead and read the next two.
A key feature of the Affordable Care Act is decreasing access to affordable care.
That's false. That's incorrect.
That's false. Yeah, I disagree.
It's aimed at increasing access to affordable care.
True.
Exactly.
So she needs to be corrected.
Okay, we agree. Next one.
A key feature of the Affordable Care Act is improving quality and low. She does not need to be corrected. That is what the key feature of it is what it's supposed to be for.
Yeah, that's what it's supposed to be for, yeah.
It's supposed to make everybody go to the hospital to get, help because it's affordable. So now everyone qualifies for insurance, but they're supposed to keep the cost low, but they don't always keep the cost low because all hospitals follow Medicare guidelines, which is a cost across the board, regardless if you have the Affordable Care Act or not.
But the feature of it, and you are correct, is improving quality and lowering costs. Now, so there's always that gray area, and remember, insurance companies in some places are in business to make money. So they identify those gray areas in which they do make money, because they've identified the gray area and they can say, oh, well, yeah, the whole act was to do this, but because they have this gray area where they're not really clear about it, and we're in business to make money, and so this is what we'll do. But essentially, you are correct. A key feature of that act was improving quality and lowering costs. But because you have people that are in business to make money, they identify those, yes, and those areas, and that's what they do. A key feature of the Affordable Care Act is, go back up. Hold on, let me make sure you all understand this concept. So if I were to ask you, go back up a little bit more. Go back up. Okay, did it? Go back up a little bit more. So out of those three, healthcare costs are kept low. Well, if it was stated correctly, let me just read it this way, because I don't want to confuse you. Let me read this. Let me pull mine up. So again, another test taking tip, you all, and you all did it. Make sure that when you're reading the answer choice, that if it has two parts to it, make sure that both parts are identify what they're talking about, and make sure that if the first part of the answer choice is talking about one concept, if that part is true, the second part, make sure that it's true for whatever that concept is. If a part of that answer choice is not correct for that concept, that cannot be the correct answer choice. It's all or nothing. Okay, so if I were to ask you, what statement best describes the cost of healthcare in the United States, which one would you say is correct? Which statement best describes the cost of healthcare in the United States? What would you say? Here's answer choice A. Healthcare costs are low, which has resulted in poor health outcomes. Healthcare costs are low, which have resulted in poor health outcomes. Or would you say the best statement that describes the healthcare in the United States is healthcare costs are the highest in the world, but the indicators of health are not the best worldwide? Which one of those is the best statement that describes the cost of healthcare in the United States?
The last statement.
See.
Okay. All right. Go on down on the case study. Move on down. Who's reading for us? Who's talking us through this?
M states, let us consider developing an evidence-based community preventative service guide. The first or priority step in evidence-based practice is to cultivate a spirit of injury, a curiosity about the interventions that are being applied. Determining the question one wishes to answer. Lucy asks, what should the guide include? Lucy states the following.
Okay, wait a minute. Hold on. You are going too fast. Go back.
Sorry.
That's fine. I love it. Go back up. So I want you to understand what is there. It was packed with information. So Kim and Lucy or Stacy, I may have changed names on you all. They're considering developing this guide. So the first step, which is first and priority in evidence-based practice, is to cultivate a spirit of inquiry, curiosity about interventions that are being applied. Like what is going on? What are they doing? So first and foremost, they need to determine what is the question that they wish to answer. So determine what is the focus, like what is the problem? What is that question one wishes to answer? Do we understand that? Okay. All right, now go on. Just wanted to make sure that we understood that part, because that was kind of loaded. All right, here we go.
Ready? Lucy asks, what should the guide include? Lucy states the following. Is she correct? First one, we should recognize current practices, identify gaps, and additional resources needed to follow best practice guidelines.
Do we need to recognize? Do they need to recognize that?
Yes.
Yes.
Okay.
Yes.
recognize current practices. You want to identify those gaps, additional resources needed. Great, I agree. Keep going.
We should not assemble an interdisciplinary team to guide the review of evidence process to establish best practices.
Disagree.
Disagree.
Do we all disagree?
Disagree.
Okay. And so we should assemble an interdisciplinary team to guide review of the evidence process to establish best practices. So again, 10-second tip, look at those keywords. So you can miss the part of we should not. You might just read assemble and you would say yes, but that one word makes that answer choice or that statement incorrect. We should assemble because we want to get everybody on the team because they know their perspective and we collaborate anyways. Great. Keep going.
We should not identify issues and barriers to implementation and recommended interventions based on research. I disagree.
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 So we should identify issues and barriers. We should. Great. Keep going.
We should identify the number of, for example, ovarian cancer cases in the community and publish a list of oncology providers.
I disagree. They should already have an oncology if they already have an ovarian cancer.
Well,
Agree.
if they see that it's a community thing,
I think that you should identify the number of. Yes.
Keep going. Let me hear from someone else.
I agree. Primarily I work for a colonoscopy center, and we're doing more and more cases like all the time, and we're diagnosing more and more incidents of cancers. So I think that's very important.
Professor.
They already have it. They already have ovarian cancer. They're past, like they need treatment now. That's tertiary already. So it's like
right.
You're not screening, you're not identifying. No, they already have it. Hopefully
They already
have a provider.
Exactly. And and you all are right. That is the twist to it. Because they already had it. Yes. Now, had they not, then we would. So yeah, I agree with that. Okay. Keep going.
so are we agreeing with that statement or are we not? I'm a little bit confused.
We're not.
Okay, got it.
We don't need to. We do not need to identify. Go ahead. What we got next? Because remember, we were talking about evidence-based prevention also, you all. So like he said that do you understand they already have it? So evidence-based prevention. So they already have it. Okay.
Okay, and we probably should think about the best way to address an outbreak of a new infectious disease using the evidence-based practice.
Can you scroll down?
Yeah, I don't know why that stuff's spaced out like that.
Discuss risks and vulnerable groups face. Oh wait, that was part of the previous one. Then answer the following: true or false.
Okay, so yes, so let's stop and like I said, I'm not sure why that's spaced out like that. So let's discuss risks that vulnerable groups actually face.
Ask the clients about their finances because it's important information. I think that's true.
Yeah, that's true.
I try to observe and ask the client to explain about their cultural traditions as part of my assessment. That's true. You should do that.
Okay.
I understand that people in vulnerable populations do not face any special health circumstances. I say
False.
False.
Keep going.
Always at the client's exposure to social health hazards such as crime and violence. True.
True.
I make sure to do a complete assessment of any environmental hazards such as lead exposure and from lead-based paint, from peeling walls or paint used in toy manufacturing. True.
Okay. And so I'm just going to throw out another test taking tip out there. If a question asks you to select all that apply, read each answer choice, and you might like true or false, correct or incorrect, however you like it. You read, if it says select all that apply, read each answer choice just like you just did. Is this correct or incorrect? And if it's incorrect, you will not select that one. But if the statement is true or correct, don't be afraid to select it because it's true. Okay, go ahead.
Who is at greatest risk for becoming a member of the vulnerable population? A single mother who is studying for a law degree at the local university. B, a 50-year-old married female who has worked as a server in local restaurants for her entire adult life. Or C, a single male who has a history that includes a learning disability and a parent diagnosed with type 2 diabetes. C.
D, agree.
A.
Why are you all saying C? And so, okay, so we have, so A and C are similar. What's the difference between A and
diagnose the family history of the family history of diabetes?
But it doesn't say whether or not the male would be taking care of the parent. So he may or may not need to know about the diabetes.
Look at it. Keep looking. Look at A and C.
He has
Go ahead.
He has a learning disability.
Exactly. So both are single. A and C both are single. But we do know who was that. What was? Let me look at you all. Who is it? Someone says socio determined health. Yes. So go back through all your files when you're reading through. Okay, wait a minute. Well, we know B. They're married. Everything's okay. But A and C, they're similar. So what's the difference? So go back to your files, open that drawer about social determinants of health, social economics, where we work, where we live. All those things influence our health. So even though both are single, but if a person has a learning disability and so they have a learning disability, that's going to be something that will hinder, even though we can identify resources to assist, but initially that person is going to be more vulnerable or at risk for something. Do we agree or disagree?
Agree.
Okay. All right, great. Keep going. All right, so hold on. Which level of prevention? How many levels are there?
3.
Tell me about the first one.
Primary. It's about information, informative measures to prevent. Primary is based on like trying to prevent something from happening before it happens.
Okay, next. Do we agree what she's saying? What's next?
2 is screening. Screening, trying to identify if they have it or not.
Okay.
Which is secondary.
So we agree. We need to add something else in. And what's the last one?
Tertiary, which is aimed at preventing further damage of a disease process that's already diagnosed.
Okay.
So tertiary is aimed at preventing further damage. You already have a diagnosis. So, yeah.
Okay. Let's go. What we got? Which level? Administration of skin tests to identify persons who have been infected with the tubercular bacilli. Where we at? Which level?
That's true. That's 3.
Secondary.
That's 3. She's been infected. She already
Have
has
they?
it.
So, but go ahead.
To identify, that's secondary. Sorry, read it too quickly.
Okay, why did you change it back to secondary?
Because it's to identify if they have it, not because they already have it. I
It's
just read
testing to
with.
see.
So remember those key words, you all, because initially, oh, she's been infected. but we're trying to identify. So, okay, go ahead.
Assessing for signs and symptoms of active tuberculosis. That is
Tertiary.
secondary.
Secondary.
I heard second and third. Which one is it? Look back at it.
Second.
You're assessing for signs and symptoms.
So we're that little detective. We are trying to see if there's a disease, deficit, or injury. So it is secondary. Okay. Go ahead.
Directly observing clients with active tuberculosis as they take their anti-tubercular medications. That is tertiary.
That is true.
So what for sure makes this tertiary? What's that one word?
Anti-tubercular medications.
Active
tuberculosis.
Yes, active tuberculosis. Yeah, got it. Okay, great. Keep going.
Interpretation of tuberculosis skin test findings.
Ooh, tertiary.
Secondary.
That's secondary.
Secondary.
Testing screen.
Secondary.
Tomato. We really just said that in a different way. So yes, it is secondary. So think about it. So we're still trying to see if there is a disease, deficit, or injury. We're still trying to see, which is trying to see, detect, screen. That is secondary. Okay, great. Keep going. Okay, go ahead.
One way Healthy People 2030 differs from the previous version is increased focus on health equity and the social determinants of health.
Okay, let me pause you right there. Make sure you understand and digest that statement. Okay. One way that it differs from the previous versions, every 10 years it changes, is that it has increased focus on health equity and social determinants of health. Make sure you understand that. Okay, go ahead.
Discuss the following overarching goals of Healthy People 2030.
So first off, before you start discussing, each of these are overarching goals for Healthy People 2030. So just know that. Ding, ding, ding. You need to know that these are. So, okay, now let's discuss each one of them.
Okay. You want me to keep going or?
Yes, someone read the first one and let's talk about it. What does it mean to you?
Attain healthy, thriving lives and well-being free of preventable disease, disability, injury, and premature death.
So what does that mean to you? What are they talking about?
They want to maintain people to be free of disease or disability, or try to end premature death. They want thriving lives.
Better health promotion. Yeah, improve just the overall quality of health and life of individuals through whichever means necessary. You know, like decreasing obesity rates in juveniles, for example.
Building those sidewalks so they have somewhere to walk. Having those new playground equipment so they can't go to the playground and play, and so that they can get up and moving so that it directly impacts obesity. Great. What about the next one?
Eliminate health disparities, achieve health equity, and attain health literacy to improve the health and well-being of all.
Yes.
One has that literacy in there. What are they talking about?
Like literacy is like basically having an understanding of health and well-being, and the disparities is talking about like the racial disparities, the socioeconomic disparities, the things that show where poor people have poor health and they don't get the best care, or African Americans going in and having like prejudice and stuff like that.
Yeah, like mortality rates for African American mothers is greater than for Caucasian and Latino mothers, even though Latino mothers is still lower than for white mothers.
Exactly.
So definitely.
True.
Anyone else? Okay. The next one.
Create social, physical, and economic environments that promote attaining the full potential for health and well-being for all.
What about the smoke-free campuses? Are we in? And we're not here to debate or say anything's right or wrong, but you know everybody's smoke-free now. So you know they're not telling you that you can't smoke or whatever, but they're just saying don't do it in the place where people are. And so yes, attaining that full potential for health and well-being for all. So making a decision that's going to impact the most. We know, you can always have that gray area, as I call it, but the best for everyone, the well-being for all. Okay, and then the last one.
Promote healthy development, healthy behaviors, and well-being across all life stages.
Okay. So someone mentioned it earlier about the nutrition, the person working at the pantry and handing out the food, but someone added in, well, hey, if they're teaching about the health, the nutrition, then that's more impactful. So yes. So healthy development. I know when President Obama, Miss Michelle, she actually what was the name of her movement? Because each one has their health initiatives. Hers was Get Up and Move or Let's Move or something like that. And I remember in our school, the school lunches changed. And so everything was like we didn't have for example, white cornbread. It was wheat cornbread. The hamburger buns, they were not white hamburger buns. It was wheat hamburger buns. And so even the vending machines, things changed. Things went to zero Coke or zero whatever in the machines. And so it promoted, because like when I went to high school in school, we had pizza, hamburger, and fries pretty much every other day. So it's like, oh mercy. So you can imagine our health, the health of us compared to the health of these babies that are have already been impacted with making those healthy food choices where they didn't have a choice. Okay, well, this is what they're eating. So, okay, so over a lifetime, then they should have better health outcomes. They should live longer, stronger, and have better quality of lives because we have started early with changing those health behaviors to healthy habits. Great. So all of these, to take away from this all of these are goals, overarching goals of Healthy People 2030. These are correct. All right, where we're at. Is this the end of the case study? All right, the last one says engage leadership, key constituents, and the public across multiple sectors to take action and design policies that improve the health and well-being for all. And I'll just add this tidbit right here. So I got the idea when I was typing this up. We actually, I taught high school. So one of the assignments was we were talking about genetic disorders and just diseases overall. So the assignment was to design a letter and a speech to talk to the actual congressman. The students, they selected who they wanted to, after everyone did the assignment. And our Congress lady actually had a town hall. And so the second part of the assignment was to do a speech. And we actually got on her agenda. The students went down and they actually spoke. And they advocated for health policies and work places of employment having different, I don't know what they called it. They created this, how we have vacation days off and sick days off, but it was a different type bank. So and it was all voluntary, if your child had a genetic disorder or some type of disorder, they had a list, then they advocated for employers and the government supporting the employers to support the families, because we do know if you have a sick child, you do need more days off than someone that does not have a sick child. And they specifically identified certain disorders, and they advocated that the congressman wrote policies and procedures to offer those different things and resources to support people because we are different sometimes when with health things, with health outcomes and health events and things. And so they actually went in and got on the agenda, they actually spoke. So you want to engage leadership, key constituents, and you just get in where you can because you just never know. So they didn't just go and say have a problem that day. They also came there with solutions. Now, whether or not she actually went forward with that, but that's how you engage leadership. So, because sometimes they just don't know about certain things, but they're the ones that's making these policies, and who has to live with them? We do, all of us. And so that's what that one's talking about. All right, keep going. Who's going to take us on in? Go ahead and read this last little bit here.
Is it the building on the family? Have you read that already?
Yeah, building on family strengths. That's where we're at.
Okay, I just wanted to make sure.
Yes.
And resilience is the best approach for the nurse to be helpful when a family is confronting major challenges to their health. Discuss that. Or do you want me to just read the list for things?
So let's answer what it's asking here. Let's see. Let me come back to the screen here. It says list 4 things. Okay, first of all, building on family strengths and resilience is the best approach. So you need to know that. Key point. Building on a family strengths and resilience is the best approach for the nurse to be helpful when a family is confronting major challenges in their health. So we want to identify those strengths and their resiliency, because that's going to, you know, they're being faced with the issue. We want to promote those things that they are good at, they're strong at, so that the challenges that they are facing, that they will be more apt to the solutions that you're bringing to them. Because, you know, sometimes I think it's maybe human nature. We kind of, when we're faced with a challenge, we think about the challenges or the weakness, but we need to bring attention to their strengths and their resilience. And then they're more apt to accept those different resources and approaches that you are, have identified for them. So now let's list 4 things that must be firmly established before beginning a family assessment. What do you think?
Is that like determining the purpose of why you're there? Like things like that?
Yes.
So you want to have them understand why the questions are being asked. Like, why do you need this data? So that's a separate one from actually them understanding the purpose of the meeting. And then things like the best time, like when is the best time for you to have to complete that assessment, things like that. Those are some of the things you want to establish.
And they must be open to the questioning too.
Right. And so with that, with giving them information about why you need the data and how it's going to be helpful to them or how it's going to benefit them, that's going to make them more open to answering your questions.
I think it's important to identify roles in the family too, because some cultures, it's like you need to talk directly to the man and the woman is not allowed to answer. So I think identifying, like being familiar with the roles in the family and the culture as well.
I agree, Kayla.
So which family members can be available, the rationale or the reason, the purpose for the visit, the most convenient time for you to visit the family, and then why the data is needed. You all have just done really well with that. I think, are we at the end of that? Okay, let's switch gears real quick. Great, you all did great on that. Let's switch gears to Kahoots. Go ahead and stop sharing. And so we're going to take our break at the end. Or you're like, when are we going to take a break? So that means we have 10 minutes left in class. So let's do the last 10 minutes of the Kahoots. Right here, let me pull this up and give you the pin so that you can log in. Let's see here. Let me press start live and start live. Okay, it's pulling it up here. The pen will be available when I share my screen here in a minute. Let's see, share screen. So while we're waiting on the pen to load, the 3 questions that we had, the live reviews, I'll send a message just reminding everyone, you know, that some of you are saying that it's not posted in your course room. The other one was, did we find out where the in-class questions were? Because it was a different edition, so you had to go a different way of identifying it. Did you all link up and find that out? Everyone knows where that is? How to get to your in-class questions? Are we straight on that? And what was the third thing that we had an issue with when we initially started? Somebody remind me.
CJ Sims.
CJ Sims, Nurse Think. Go to your Nurse Think email that was sent a couple of weeks back, but it's Nurse Think. And it has your username and your password in it. You can change it once you actually get inside of it. We say CJ Sim, but it is CJ Sim, but it comes from Nurse Think. All right, so here we go. Let me see what the little start thing is. Do we have everyone in? That little start button. Let me stop sharing for a moment. And I'm gonna share back again here. Let's see if I can find the start button. So it's so many on here. I don't see. Okay, I see it now. Okay. Start back to share again. Share. Okay. And here we go. Everyone's in. Let's go ahead and start. And can you all see the screen? Okay.
It's very laggy.
Yeah, I'm trying to move us out of the way. And we're gonna run out of time before we finish it. So, but just make your way through. Just go through them. We're not gonna finish all 20 questions. So. Muted myself because I tend to want to talk and I don't want to tie up your time from reviewing the questions. So I'm muting myself so I can be quiet. Am I clearing the question too fast, you all? Do I need to slow down about moving to the next question? Or are you all okay with it?
That's good.
Okay. Okay, so we will stop there. We have like 30 seconds before it's break time, and I do want to honor your break. So I did send a message to the professors letting them know that some of you all are saying that you do not see the exam review schedule in your announcements. And so that has been communicated. Check your email for Nurse Think. And also, what was the other thing you all helped me with? We said the third thing was NCLEX. So what was the solution for NCLEX? She told you to go to click a different button and find those categories. Okay, so you all reach out to each other if you have questions and are having problems. Reach out to your instructor. Reach out to each other, and you all take care. And we're going on break. The next 10 minutes is your break, and so this is the end of class.
Can we get that case study or no?
I don't know. It's not. I don't want you to think that it's something real. That it is just something that I created. So
Okay.